Heterotaxy translates to different arrangement. Hetero meaning different, taxi meaning order of arrangement. Heterotaxy syndrome is a congenital condition meaning present at birth. Heterotaxy is also known as situs ambiguus, Ivemark syndrome, polysplenia syndrome, or asplenia syndrome. Situs meaning location of organs, ambiguous meaning more than one direction. Heterotaxy is a laterality defect. Situs inversus totalis, which is total reversal of organs, is also a laterality defect, but is not the same as heterotaxy. Heterotaxy syndrome causes organs to be misplaced, duplicated, malformed, or completely missing. At least 3 organs must be affected for a diagnosis, but there are some exceptions to this rule. Heterotaxy syndrome can affect all organs and body systems, including but not limited to bone, muscles, vessels, gallbladder, appendix, brain, pancreas, kidneys, and esophagus, but most commonly affects the heart, lungs, liver, spleen, and intestines. Heterotaxy is a rare disease occurring in 1 in 10,000 births. That's 400 per year in the US, or just over 1 per day. Worldwide, that's 14,000 per year, or 38 per day. Heterotaxy is genetic. Some cases have been linked to chemical exposure in pregnancy, likely causing genes to perform abnormally. These genes affect how organs form along the right to left axis. The genetic changes can be de novo or random, autosomal recessive, or autosomal dominant. Scientists have been creating heterotaxy in animals by manipulating genes for several decades, long before it was understood in humans, though many providers still don't know what heterotaxy is, and most will never see a case of heterotaxy. Over 60 genes have been identified that cause heterotaxy syndrome, some of which are also linked to causing congenital heart disease in non-heterotaxy patients. With genetics testing being in its infancy, genes are very slowly being linked to heterotaxy. Recently, it has been found that some heterotaxy genes are responsible for causing some complex heart defects without affecting other organs. Heterotaxy syndrome can range from mild, non-life-threatening, to severe, high risk of death. The most mild of cases may not even be found until the person has imaging for other health concerns. The effects of heterotaxy take place in the early embryonic stage of pregnancy, usually before a mother even knows she is pregnant. By 12 weeks of pregnancy, nearly all organs are formed, with many being formed within the first few weeks. Mortality rate of children with heterotaxy without congenital heart disease is approximately 18%. This is often due to liver, intestine, and spleen-related defects. Heterotaxy is usually categorized as RAI, right atrial isomerism, or LAI, left atrial isomerism. Isomerism means equal parts, though some cases do not present with isomerism. While the outside of the body is symmetrical, the inside is not. Isomerism creates symmetry on the inside associated with either left or right-sided organs. Left atrial isomerism often includes moderately complex heart defects, polysplenia, intestinal malrotation, 2 left lungs, midline liver, and right or left-sided stomach. On average, LAI causes less severe and complex heart defects, however, some cases do include very complex hearts. Mortality rate of children with LAI and complex congenital heart disease is 50%. Right atrial isomerism often includes severely complex heart defects, asplenia, intestinal non-rotation, 2 right lungs, midline liver, and right-sided stomach. While RAI usually includes the most severely complex hearts, some cases have less complex hearts. Mortality rate of children with RAI and complex congenital heart disease is 85% at age 1, 90% at age 3, and 95% at age 5. The higher mortality of RAI is due to the total lack of a spleen and more complex hearts. 70% of heterotaxy patients have intestinal malrotation or non-rotation. Malrotation and non-rotation is when the intestines fail to rotate appropriately and secure themselves in the proper position in utero. Other gastrointestinal issues associated are annular pancreas, pancreatic dorsal agenesis, preduodenal portal vein, anal atresia, tracheoesophageal fistula, microgastria, undescended appendix, and biliary atresia. These can affect function of digestion and proper nutrition. 10% of those with LAI have biliary atresia. Biliary atresia is a life-threatening defect and often causes liver failure early in life. At least 13% of heterotaxy patients have musculoskeletal anomalies. Associated skeletal malformations include tethered cord, missing or extra vertebrae, missing ribs, and wedge-shaped vertebrae. These can impair neurological function and cause scoliosis or kyphosis. At least 10% of heterotaxy patients have central nervous system anomalies. Associated central nervous system malformations include hydrocephalus, absent or thin corpus callosum, hollow prosencephaly, meningomyelocele, and encephalocele. At least 26% of heterotaxy patients have genitourinary anomalies. Associated kidney malformations include horseshoe kidney, ureteral abnormalities, and hypoplastic, dysplastic, or absent kidney. This can complicate the use of diuretics for congenital heart disease and impairs kidney function. At least 92% of heterotaxy patients have abnormal lung morphology. The majority of heterotaxy patients have 2 left or 2 right lungs. The left lung has 2 lobes, creates space for the heart, and has long bronchial tubes. The right lung has 3 lobes, short bronchial tubes, and creates space for the liver. Nearly 40% of heterotaxy patients have PCD, or primary ciliary dyskinesia, a lung disease that acts similar to cystic fibrosis. PCD impairs airway clearance from the upper and lower respiratory tract. Cilia are also what are responsible for turning organs into their correct positioning and location in utero. Heterotaxy patients often have abnormal veins and arteries. They may be tortuous, duplicated, or take an abnormal route. This makes blood work and line placements more difficult. Most heterotaxy patients either have no spleen or no splenic function, impairing their immune system. The spleen removes infected, old, and damaged blood cells from the body. Lack of a spleen or splenic function impairs the ability to create immunity and increases the chance of septic shock. 90% of heterotaxy patients have congenital heart defects. 3% of all congenital heart defects are caused by heterotaxy syndrome. Common congenital heart defects in right atrial isomerism include bilateral superior vena cava, total anomalous pulmonary venous return, unbalanced complete atrioventricular canal defect, absent coronary sinus, double outlet right ventricle with pulmonary stenosis, and sometimes crisscross heart, though they can also have several more defects or less. However, these CHDs are more commonly associated with RAI. Common congenital heart defects in left atrial isomerism include interrupted inferior vena cava with azygous continuation, partial anomalous pulmonary venous return, balanced atrioventricular septal defect, and abnormal hepatic connections. They may have several more or less heart defects. However, these are more commonly associated with LAI. 10% of those with LAI have congenital complete heart block. This can cause dangerously low heart rates and require pacemaker placement at birth. Early attempt at biventricular heart repairs are crucial for improving the survival of those with heterotaxy syndrome. Due to heart, liver, and lung abnormalities, Fontans and Glens can be more risky and in some cases are not even an option due to significant risk of fatal complications. In addition, Fontans eventually require heart transplantation, which is not an option for some with heterotaxy syndrome. 33% of those with left atrial isomerism are able to have full biventricular heart repairs, though few with right atrial isomerism achieve a full heart repair. This is due to often less complex hearts with left atrial isomerism, and biventricular function is more likely to be preserved in LAI. However, due to complex defects occurring in both types, it is not always possible, and only a handful of surgeons around the world are capable or willing to attempt a biventricular repair on the complex hearts of heterotaxy kids. Even if some organs appear normal, heterotaxy can still impair their function. Therefore, problems can arise with organs that are otherwise normal in shape, size, or location. There is no cure for heterotaxy syndrome. However, there are surgeries and procedures that can be done to prolong life and preserve quality of life.